You're listening to Health Innovators, a podcast and video show about the leaders, influencers, and early adopters who are shaping the future of healthcare. I'm your host, Dr. Roxy Mooney. Welcome back, Health Innovators. On today's episode, you're in for a real treat. We are hosting another executive briefing with some brilliant leaders and great colleagues and friends. Jeff Carlisle, the president of Pneuma Systems Corp, Howard Rosen, CEO and founder of LifeWIRE, and Brent Wright, the Associate Dean for Rural Health Innovation at the University of Louisville. Welcome back to the show, guys. So as we think about our audience, most of our audience, I would say probably about 60% are innovators, whether they are an intrapreneur or whether they're an entrepreneur. And we talk a lot about on the show about how really it's not the technology that ends up being the problem with successfully commercializing something. It's most often not even funding, although we know that there's some obstacles sometimes with funding, but it's usually not funding and it's not the technology. It is the commercialization strategy and all those decisions that are made along the way. So I invited you guys here today for us to kind of talk more about that. I've talked a little bit about bits and pieces here and there, kind of peppered in throughout every episode of the show that we've produced, but never really had one episode that's kind of just dedicated to this topic. And so I think it's great to have you three here joining me today for us to kind of get your perspective and just kind of powwow about this. Like, what are those key steps or stages when you're commercializing an innovation? Love to hear what all three of you think.
No, when you do commercialization, you're really dealing with fundamentally having to understand your customer and the customer's needs, because you got to be able to commercialize. You got to be satisfying that need or a problem that they have, and you'll be able to present them with a solution. So it's really the first step is being able to articulate that, and frankly, being able to confirm that target customer understands what you're trying to solve and that there's interest for it. Because there's many times that innovations and solutions have been developed in a garage, for lack of a better term, and go, what a great idea. I think this is perfect. But they really actually never spoke to anybody about it, or the target clients. When they spoke to them, shock and dismay, oh, we're not interested. So I think the key first step is making sure there's actually interest in a customer for what you've come up with.
Yeah, I think, Howard, the whole focus should be on the results of what you're doing. It may be innovative. Okay, that's an interesting descriptor, but you're not selling the innovation, right? You're selling the results of what you do. And okay, somebody else may make an observation that it's innovative, but you shouldn't be the one to talk about the innovation. There's an absolute direct inverse relationship between the number of times innovation is mentioned in the annual report and the actual innovation in that company.
Not surprisingly, right? If you've got to tell somebody it's innovative, there's a problem.
Exactly.
Well, that's why I keep mentioning how handsome I am, I know no one else is going to do.
Ron, yeah, Roxy, tell us about some other key steps.
Well, leave it to the academic here. As Howard and Jeff are talking, I'm sitting here trying to write a formula. Using the terms. And these are the three terms that I focused on. We're talking about innovation, that's a given, and we're moving towards how the stages to commercialization. But I'm working with the terms solution. And if an innovation equals a solution, then you have a pathway to commercialization. Now, maybe somebody with higher order math there, maybe there's a derivative or some sort of calculus equation there that we could come up with. But really, what I've heard described is the dilemma of a lot of inventors. I mean, inventors, consider themselves innovative, but they become too wed to their innovation, and they don't really see whether or not they have a market. They just love what they're doing. They're just passionate about that area. Yeah. And it's more of a hobby, or it's something that really is going to be seen more by the market as indulgent. And that's why it's very difficult to be disciplined and go to the market and really ask the tough questions of, hey, this is what we're thinking. Is that the right style of thinking? Because, the phrase begin with the end in mind. I mean, the end is a sale, and the end is commercialization and having a sustainable business. So really having that discipline, and it's not complex. I mean, just a clipboard, a pen, and a piece of paper, and just talk to people who are your future customers to make sure there's going to be a pathway, because you hate to spend obscene amount of money and then get there, and then there's just, hey, nobody wants what you have.
Definitely. Yeah, because if you invest millions of dollars in something before you do that validation, now you get some feedback that tells you you're wrong.
Right.
You don't want to believe it. You're like, no. I have to keep moving forward in this direction because I'm so vested. Can't go back to my investors and my board and tell them that, oh, well, nope, I was wrong. Not at that stage.
Part of that enthusiasm, of course, is helpful because until you've shown somebody, not described it, but until you've shown somebody the result of what you've done, they can't react to it, right? Everyone knows, right? People didn't want automobiles, right? They wanted horses that ate less food. That's what they wanted, a horse that ate less food. But they didn't want an automobile, but once they were shown that, then...
exactly. Because in many cases... Go ahead, sir.
Go ahead.
No, please go ahead. Go ahead, Jeff.
I was in the company that... where we were working on a predecessor product that led to one of the most famous commercial collapses of all time, and that was the Segway, right? No product had ever been pumped and hyped more. No product had ever been pumped more than that, and all the secrecy and all that. And then when it came out, it was an utter flop. So that's a great example of something that was very, very well executed, had lots and lots of innovation, and absolutely did not make a difference in anyone's life.
That is the perfect example. And I think Wozniak lost a lot of money there.
But Jeff's point in terms of talking to clients, you do have that fine line, because in talking to them versus showing is most people don't know what they don't know. So asking them with certain garb, not understanding the bigger pictures, is sometimes hard as well. So there is a line of how you bring that about, and a process. It's not just ask once and that's it. It's an ongoing process in terms of commercialization, even in terms of commentary and reaction with prospective clients, because it is, they don't know what they don't know. They know buzzwords. In many cases, if you're asking what do you need, that's likely the last thing they need because it's the most recent buzzword they heard.
Yeah.
But it is that process of showing them what the needs are and what you're doing, because showing considerably better than talking about it. And that's a balance between investment and not investment. How far do you go down that road? As you know, Jeff was talking earlier, it's entrepreneurship is you're in a wonderful high wire act. It's just how much you're willing to look as you go forward.
So we're talking about customer discovery and testing, our business ideas that we have. What's next? What do we do after that? Let's say we've got some validation of problem solution fit. Where do we go from there?
Well, you mean are you saying that after the stage where you've actually validated the end user response and they want it?
Yep.
Well, then you get into an easy phase of kind of a make-buy, processing scale. Can you make it? How do you deliver it? Those are kind of the mechanical ends of it. But if you've really gotten over that edge where you've shown that customers like it, you do the mechanical things, and then you have to spend a lot of time asking yourself, who is this going to hurt, right? And not who's going to help. Who is it going to hurt? Who's going to want to kill this idea? Is it a competitor? Is it who knows who it is? But someone is going to get their nose out of joint if you launch this product, and you need to be very aware of who will be upset by it.
And sometimes those people could be internal to your organization. Like if you talk about digital health and redeploying resources, meaning you'll have less clinical staff or whatever it's going to be, the inclination there is perhaps not consciously, but it's like you're not going to get the same enthusiasm as you would like. And that's what we always talk about in terms of the innovation, and the hardest process we actually found is not finding the customer. It's actually the implementation process where you're actually working with the entire ecosystem of the company or the organization to make sure they all buy into what you're doing and actually use the product. Because there's someone who, because you get the C-suite into it, you get the senior VPs, you get the VPs. It's down to, okay, the trench warfare side. Those are actually going to be dealing, or in terms of health, working with the patients. Are they going to use it, and they're going to help encourage the patients to use it, or whatever the solution is? But you need everyone to buy into it, and an implementation process. To Brent's point, we've talked about this in previous discussions, that it can't take them any more time to use. It's got to take them less time to use. And it's like all those processes, because if you take more time, you're going to get, again, I don't have time for this. So it actually gets rather complex at that stage, but you have to have that fully worked through beforehand. Throw the playbook out once you get into the real world working with them, but at least you're prepared for that entire process.
Yeah, the one thing that comes to mind when I hear you guys talking is AI. So as I'm working with clients that are bringing some type of AI solution to market, part of what the challenge or obstacle that they're facing is exactly what you just described, Jeff, is the people that, yes, this is innovative. It's great. It solves a problem. It's more efficient. It's more productive. It saves us, millions of dollars, but it also takes my job away, or it takes my team and my department's team away. And so we're going to come up with every excuse in the book on why it doesn't make sense and we can't do it. Yeah. And PHI. No doubt about it. So how you message that, how you position that is really critical, and you can't position it well or message it well if you haven't done your research and analyzing those things that you guys just talked about.
Qualifying your customer in the early days is really critical. So you look for those departments, impediment departments, usually the IT department, but it could be anywhere. And legal or IT or some other ancillary group, you need to walk away. If you've got a client, an early client, and you've got a powerful person who's against what you're doing, go somewhere else, because you need critical successes in the beginning, and your relationship with your client shouldn't be early on a vendor-supplier relationship. It has to be a collaboration, right? It's got to be a partnership. And if one of those entities within that partnership isn't working for you, go somewhere else.
Mm-hmm. Mm-hmm.
You clear, as part of that process, you need that referenceable clients and those recognizable referenceable clients to be able to help move that piece forward. And if you don't have that, or if there was not a good experience, particularly to Jeff's point, if someone's powerful there, you don't want them talking anything about you except glowing terms. And if you're not going to get that, treat it as a marketing issue. You've got to find another marketing. You got to find another plan, because you'll be dead in the water.
So you guys kind of touched on the targeting and kind of identifying the customer. This is something that I think seems really easy, but it also can be very difficult. And I think there's a lot of challenges and pitfalls around that, especially if you can bring your solution to multiple different market segments. And then, how do we identify them? How deep do we go? So sometimes we might say, oh, I sell to the doctor's office. That's my target customer. And then I've heard clients where they really don't sell to the doctor's office. It's maybe the referral coordinator or the practice manager that's in the office. So they don't even refer to their target customer in the right way. So how are they going to message the right person or really understand where to find them online and present that offer to them if there's kind of this disconnect between who we're really targeting? So, what's your experience with that? Do you find that something that's really easy to do? Have you wrestled with it? What's really worked for you?
Well, certainly from my experience, it's actually a very difficult process, because like everything else you go into it, well, it's clear, this is my client, but then it goes down to understanding how the client works. And also, where are you at? Are you dealing with a national payer, for example? Or are you dealing with a state, a more state level provider? Or are you dealing with a clinical group at a local level? Because each one has a very different dynamic and decision process and elements that really tie to the business decisions that they make. Because each one is its own complex organism that you have to really understand. And again, especially when you're starting, you need to really specialize. You need to understand those local clinical groups, if that's what your specialty is, or how the national works, or how, it's really getting a deep seated understanding, to your point, because you could be targeting the wrong person, the wrong decision maker. And then you've put a lot of time and effort going the wrong direction.
In healthcare, it's almost impossible not to target. Impossible to target the right person, because the end user, the recipient, is not the one who's making the decision, who's not the one who's paying for it, who's not the one who's ultimately on the hook for it. All the incentives are disconnected. So it becomes very complex as to who to sell to, because you've got all these different stakeholders that really don't care too much about the other.
Yeah, I think these comments speak to the schizophrenic nature of healthcare as a business model. And, when you look at this, hopefully going forward, we're going to be talking a lot more about the consumerism of healthcare, because the person really at the heart of healthcare is the patient. And they're the end user here. They're the recipient. They're the one we're reporting outcomes on. So it is true. It is that it's hard to find the right person to target. Because being with the university, I'll get people contacting me all the time, wanting to sell into the university. And I just very quickly say, look, I'm not making that decision. I'm just gonna save you your time, because I have such a unique standing that I'm with the university, but I'm an hour and a half away working in an area that I work. And people just look at titles and think you can help them get into the whole university. And I just try to save people's time.
That's so true.
You understand?
You return the call, but Brent, but Brent, sounds like you actually return calls, though. That puts you in a whole new category already, just by returning a call.
A couple of things come to mind too, right? So yes, I agree. Healthcare is being a multi-sided market. It has so many layers of complexity. When we think about building our business models, sometimes we might think about building a business model just for the user or just for the buyer, and not really mapping out all of the different components for each different target segment. I find that gets really tangled up and interwoven. Or you go to a website, and so like on paper they're really clear who their target market is, but then when you go to their website or any of their communications and collateral that they're using to present themselves to the world, it gets twisted. And so it's like really not clear who they're talking to and what's that value proposition for who that specific audience is. More pitfalls and challenges along the way.
Well, you have to find people who can support the buying process of whatever you're selling, but you have to also recognize all the people who have veto power. And in a big organization, it often takes just one entity in a group to veto it, because the other ones may not, want to stake their reputation or effort or money on something if they think there's going to be a naysayer in the group. So unfortunately, it's the wrong ratio. It takes one party to kill an idea, and at least almost everybody to forward them.
And how many of our sales strategies are specifically looking for that blocker? They're probably trying to find the champion, right? Or who they're going to sell
to.
Yeah.
It's really to get that champion on board to actually point out all those blockers to the extent that they can.
Yeah.
But you know what? The churn at some of these large organizations is so amazing. It's helpful for, you got a good 6-month run, but after that, expect there's going to be a churn over somewhere, and you have to be, additional re-education or, a pivot somewhere else for a different potential, person who may be a naysayer or an additional champion. But I've
had it happen more often than not. I've had if the sales process is a year long, which it easily can be, in that year, you're going to have management inflection points, either the direct champion or more likely their boss or someone else changes roles, and then it going to start the process over again.
And I have to chime in on this one. I mean, the politics of it all. I mean, the C-suite politics, the organizational politics. I mean, it really. I think what term you used, Roxy, the blocker here. You really have to have that blocker and that pathway open and get people to support it, because you're not only are you going to get naysayers, but you also are going to have to deal with the haters out there, because if you pick a really good product and that makes the organization work well, it does well for the organization, you're going to boost your clout, and there's always going to be people there trying to clip you. And I hate it. I hate that. I really hate that. But I deal, at the university, I deal with some young, early stage companies. And I really try to position myself in how I bring them in. So I try to remove some of the bureaucratic hurdles until we get some early success, or until we can sort of find the right timing to move forward, because sometimes it's just not the right time. It's not against the product or the innovation. It's just that there's not a climate to bring that into. And you need to get through some other issues for the organization that maybe that, innovator doesn't understand.
Brent, 20, 30 years ago, they had an upper level management meeting at Hospital Corporation of America, and they talked about innovation. And we happened to connect with them like 3 days after that event.
Yeah.
Had we connected a week later, the half-life of that exuberance would have died down. Literally 3 days after this seminar, which we had nothing to do with, they said, "Oh, that's innovation. I'm allowed to do that." And they did it. But I'm telling you, the timing, I have many bad timing stories, but that was a good timing story, where if we had come in a week earlier, it would have meant nothing. And a week later, it probably wouldn't have worked either.
So how do you master that? Is that just experience, or are you paying attention to some triggers?
There's triggers you got to pay attention to. There's so many elements. So quite honestly, some of the more difficult ones, again, depending on the size of the organization, is sometimes you have a hater, using Brent's words, because there are a few of those, because their incentive program for the corporation is you get a double bonus if X, Y, and Z happens, but your solution S, you just don't fit in their double bonus plan. And frankly, maybe not pushed aside, but you're not going to be the priority for this year until there's a double bonus. And sadly, that's part of what you see on the, again, particularly large organizations. So there's many reasons why you've got those blockers. So to the point that triggers, and to Jeff's point was, this whole conference said, use the word innovation. So yes, for 3 days, it was still resonating, going, okay, I may be, rewarded for, following up 3 days later. And here's something with the I word to use.
Well, also you get fiscal year insanity. Right? You may be approaching a fiscal year, and someone literally might have a, use it or lose it kind of fund that it becomes funny money at the end of the fiscal year. Now, those opportunities are not predictable, and they're not particularly public, but boy, do they have an impact. I mean, the time value of our money means so many different things depending on when you are in that budgetary cycle.
Yeah.
And it goes back to the need for that champion in that organization you've targeted, so you get that heads up. Or hopefully get that heads up.
I had a previous guest mention the word Trojan. I had never heard it before. I've heard champion and the blocker and, the decision makers, but Trojan, and the Trojan was just the person that no one noticed, that no one really paid attention to, but they saw everything. And they were the ones that were going to be able to tell you all the politics, all the double bonus insights, all the fiscal year, all the stuff that you really needed to know from a sales standpoint to be successful. But you would very likely just pass them by in the hallway and not pay any attention to them.
That can sometimes be the executive assistant for the CEO.
Yes.
That if you befriend and genuinely befriend the people who are surrounding the CEO, maybe with not grand titles, but that can be a very important gateway to knowing what's going on.
Okay. Hey, it's Dr. Roxy here with a quick break from the conversation. Are you trying to figure out what moves you need to make to survive and thrive in the new COVID economy? I want every health innovator to find their most viable and profitable pivot strategy, which is why I created the COVID Proof Your Business Pivot Kit. The Pivot Kit is a step-by-step framework that helps you find your best pivot strategy. It walks you through 6 categories you need to examine for a 360-degree view of your business. I call them the 6 critical pivot lenses. As you make your way through this comprehensive kit, you'll be armed with the tools, tips, and strategies you need to make sure you can pivot with speed without missing out on critical details and opportunities. Learn more at legacy-dna.com/kit. What other steps? Anything else that we haven't touched on yet? Key steps in this commercialization process?
Start small.
Mm-hmm.
Yes.
Prove it on a small scale. Someone walks into Brent and said, "Hey, I got a new Frimajammet that's going to save 3 minutes." And okay, well, let's try it in the next half hour or whatever. Just start small, because innovators think big, right? And grandiose, and sometimes psychotic, and
only sometimes.
Think big. You think about transform.
Guilty as charged.
Well, maybe I was looking at it. Now, if you think grandiose and you think about transforming the world, you got to start somewhere, right? And so start on the smallest possible scale you have, filling in any technological gaps, and just start somewhere, and use those results, not the innovation, but the results of the innovation to propel you forward.
And also, starting small allows you to deal with, Murphy's Law. Something's going to come about you weren't expecting. When it's a small scale, you could manage it much more quickly, much more easily, and probably have a heads up what's going to occur. But also for the client or the prospective client, it's not as daunting for them, because you deal with innovation and going, okay, it needs this department. He has this whole grand scheme of all the departments to involve, and again, creating this barrier. If you keep it contained, keep it tight, keep it small, you're able to sort of keep that whole perspective small, and again, it helps with the sales cycle, but also the less people involved, the more control you can actually manage how your product's going to be used. Because that's the other part of it, is you've got the sale, you've got the utilization, but if you don't have some means of helping to manage those who are going to use it for the first time, you have no idea what they're going to do. Because again, the clients are amazing at utilizing a product in a way you could not even have possibly fathomed it could be used. They're brilliant that way.
Yeah.
And so you really want that kind of means of control just to contain it just for that initial rollout.
I think that is so critical. And that is one of those things that is just overlooked time and time again. We are going on to the next sale. We're trying to jam everything into the existing sale and setting ourselves up for failure, and just not doing enough of really being focused small and making sure that those early customers become raving fans to be those word of mouth marketers to help with the next phase of growth.
In a similar fashion, under promise and over deliver. Mm-hmm. At every step. If you think you can do 16 of something, promise them 10 and get all revved up when you do 12.
Mm-hmm.
And that's harder to do than, because it really gets hard, because you sort of want, you've got this momentum of enthusiasm, try to keep that sale going. So you want to be able to please the client in advance, say, we're going to do this, this, and this. But it's an amazing discipline you need to actually under promise.
So I want to share this, Roxy, and this is in regards to this comment. I just was sitting next to a stranger the other day. I was taking my daughter and my wife shopping, and I was waiting on them, and I was sitting next to another husband. And just in the conversation, it turns out he was a young guy, and he'd successfully exited a company. And it was nothing. We talked about success and what it meant to have success. And he said, I worked my way through college as a server. Mm-hmm. He said, I worked as a waiter. He said, when I got into business, at every point, I looked at myself as a server and serving the needs of my customers relentlessly. And that, I mean, even when I talked about, I just said, well, what kind of outcomes? This product was making all of the cardboard covering for all of the major appliance corporations. That's where they grew this business to. Mm-hmm. in wow. Tennessee. And I was like, what kind of,
somebody's got to do it.
Yeah, somebody's got to do it. And they're very successful. So what kind of outcome measures did you use?
Yeah.
Because I was thinking, percentage damage for, return products, things like that. He's like, my customers were happy. That's my outcome. And I mean, it was so simple. And he talked about his business plan. It wasn't that good. They just went head first into it, started small, but that relentless focus on pleasing that customer. And I think it's to the point of making sure that they're just raving about the quality of your work.
And do you think that's something that we're missing? Are we missing just some of the fundamentals and basics?
Yes.
Yeah. Yes, absolutely. Yeah. And healthcare, ironically, paradoxically, they're the worst, because our solutions in healthcare are so lucrative. Yeah. If you look at it's so lucrative, it's easy to, create something that's, hundreds of thousands of dollars, tens of thousands of dollars per unit. Yeah. And forget about the people who are going to be servicing it, implementing it, monitoring it, or receiving it. Mm-hmm. So
that's
I
fundamental.
Think yeah.
So we're talking about a lot of different steps and stages, and I think it's evident just in this conversation that there's so many moving parts. There's so many things that we have to get right. So many decisions that we're making. What are some strategies for success? When we're thinking about, as you all being leaders, whether you're an advisory role, whether you're leading your own organization, what are some of the things that your guidance that you're giving to the leader, right? The CEO, the founder, to help them navigate that?
I think Brent's story just now is the best one. Hug your customer, know them very, very well, listen carefully to them, and make them happy. There's a boutique software company in Cambridge that has a sales budget of zero. And they simply make sure that every single customer who uses their product is happy, right? They spend all their money on customer service, and customers just kind of accidentally come in the door, but it's like a spider web. Once they come in, they're not going to let them go. And so I think it's that simple of just relentless enthusiasm for making your customer happy.
That is beautiful. I want to know the name of that company.
I'll share it with you offline.
Yeah, you have to share it later.
But there's also there's a guy I know who runs a business club in here in Portsmouth, New Hampshire, and it's a magical place. And I said, what's the key to it? And he said, well, we just treat every single client like they own the place. I said, well, what does that entail? Well, it entails everything, but it's as simple as it can be. Just make them feel like they own the joint, and it's a magical experience.
Wow.
Yeah, again, and it's repeating what you're hearing, but it really is know your customer and treat them. Don't run and dump. There's many companies I know, we experience, and frankly, had maybe been the beneficiary of business following, who really run and dump. They make the sale, they go, here's the product, and go. They kind of were able to push a sale through. They didn't follow through. There's no support. The customer feels, now what do we do? Which is the polar opposite. What do you need to do? They need to feel that they're important to you. And because it goes back to, if they feel they're important to you, they'll also be more invested in working on with your solution, your product, whatever that is. Just because of, there's a lot to be said for that, just that feel good. Okay, we're of value. We're not just, a number to help their sales forecast this month.
Hey, Brent,
but the follow-up is,
Brent, your cardboard magnet, your cardboard buddy?
Yes.
I bet you could drop him into any business you could imagine, and he'd do quite well.
Absolutely.
There's no doubt. I mean, you could just tell by the look in his eye, the spirit, the way he talked about things. Now, there's things he didn't like about being responsible for the business. He's glad to move on because he's at a different stage of his life. But yeah, absolutely. He's the type of guy you want to be on your team. Be an advisor, be a board member. I mean, because you could tell he broke things down, very simply. And I even asked him about healthcare. I'm like, I love interviewing people, who I just meet. And, he was talking to me about healthcare. I'm like, what drives you crazy about healthcare? So just great insight from people like that. But oftentimes we don't bring individuals like that into healthcare because even though they're running a successful business, they think, well, healthcare is not my channel. It's not my lane. But I think we need more people like that. As was mentioned earlier, that innovation comes from oftentimes, different disciplines. So I think we need to be more open to that.
And that's back to your comment. You spoke before about consumerism, to understand the patient as a consumer. And if you the more you understand that, the more you can sort of zero in on that whole process, because you've got the patient, you've got the provider, but it's satisfying all of them.
Yeah.
Right.
And understanding that you got to be satisfied and providing value. Now, the complication to your other point in terms of the extra stages, the value proposition may be a little different for the patient than it is for the provider in your solution set, but they all have to make sure you're satisfying those pieces.
Mm-hmm. Yeah. So making sure that you've got the value proposition right for each different customer segment. And then being able to make sure that the people that are on the team that are communicating that. So I can't tell you, I don't know if you guys face this or not, but every time, it's like 8 times out of 10, whenever I'm working with a sales team or sales leadership, they talk about delivering value. But when you look at their communications, when you look at their pitch, when you look at anything, whether it's written or verbal, it is a word salad. It is a word vomit. It is telling about their solution, raving about it, whether they're using the term innovative or not. It is, let me tell you about my thing. It's not let me learn about you. Let me build rapport. Let me deliver value before I ever even ask for anything. And it's like this disconnect, because fundamentally, intellectually, we know it, but then we actually get into the mode. It's like we forget all of that and we just go into hard sell, hard direct sell.
Mm-hmm. Right.
And there's so many things that we're talking about here that's not rocket science. It's just like best practice around business. And so there's 2 things that come to mind. Is one that you guys already touched on is, having an advisor like the cardboard guy or someone that's going to be able to see what you can't see and be able to guide you to that. Because no matter how amazing we are, no matter even how amazing the cardboard guy is, like he would have still had to have people around him to go, hey, well, what about this? Oh, did you see this? Because we just can't see it when we're in it. And then being open to what other industries are doing, because they are light years ahead of us in healthcare. So yes, we can't just bring them in and they're going to solve all healthcare's problems because they don't understand the intricacies, but we've got to have both on the team.
There's no question having an advisory group or one or whatever to run ideas by is invaluable. In fact, when I first came up with this idea, I was not from the industry, and I was convinced it was being done before. So I actually had 3 people who were in the industry who were advisors. Their sole job was to spend 2 years to convince me that this is already being done, and that I should just stick with my day job. Sadly, they weren't effective, and I got into it. But having that sound, and they continued on as advisors, but having that sounding board is a great thing to have, just to throw ideas out, if nothing else, that they're familiar enough with the business, that they know what you're trying to do, and to be able to bring insight from outside. Because you can't, at some point, you can't see the forest for the trees. It's impossible just because you're so deep into it all.
When Paul McCartney dreamt the song Yesterday, he woke up, he knew the song, played it on the piano, and he thought for sure that he had stolen it from, not knowingly, but he spent weeks and weeks and weeks going to every musician he could, playing it and saying, "Where did I steal this from?" Because I know I couldn't have come up with it in my dream, but so.
That's funny. I never heard that before.
One other idea in terms of customer in guiding your vision of the customer. Take a look at competitors' training films for customers or for patients in particular. More often than not, you walk away thinking, I don't know anyone who could follow these instructions. So that's one particular thing. Looking at training documentation or training films or whatever tools they have is a really, really good way to see opportunities for improvement.
Definitely. And a couple of other things that came to mind was just the NPS survey or satisfaction surveys. Again, these are things that are not like rocket science here, but I think they're often overlooked, especially when we're in an earlier stage. We think of, building out those experiences, that kind of customer experience and support much later on in the growth of the business. But I think that's a missed opportunity for us.
Yeah.
So as we wrap up here, what is, just in closing, we've talked about a lot of pitfalls and challenges and the results we're looking for and steps and strategies and tactics to be successful. What is your, kind of parting wisdom for today? What's one thing that you want to say to our audience that they need to be mindful of when they're trying to figure out their path to profit?
And we have one thing to say, because we could do another.
Well, I know it's so hard for us.
You're not being fair. You're not being fair at all to any of us. But I think, and sort of touching on what we've talked about, and actually calling a little bit from what Jeff was just said, another piece is understanding your competitive set. Because invariably, when you describe what your service is, you'll be using buzzwords, as you sort of said, innovation or otherwise, and they'll go, "Oh, it's just like X," or "I've just used Y." Like, there's reference point are going to be someone in your competitive set for the most part. And you really need to understand that competitive set to be able to either say we're like that or we're different from that. Sometimes it's good to have a competitive set to say, okay, this is a valid solution. Other times there's so much traffic in the area. How do you differentiate yourself? And you need to understand that as well. Seeing the training videos is actually very good to get insight on your competitor. But you really need to understand that competitive set and sort of choose a few key ones, because they will be reference points to prospective clients that you talk to, without any question.
Definitely.
So I'd just combine a couple of the elements we talked about. Find a champion with your target market, start small, and care a lot about the end result. If you do that, picking your clients carefully, and then ultimately though, you have to care about the results of what you're doing, and how you're doing that, whether it's innovation or you work harder or whatever it is, doesn't matter so much. It's really what did you achieve that changed the process for your client.
The results. Yeah, I think that's really important too. Brent?
Yeah, I think once we achieve that innovative solution, I think it gets down to some fundamental principles, and that's you have to have good relationships with people, because even though you're dealing with technology, I mean, it's still a human world, and we've got to work with one another. And I think ongoing relationships oftentimes pay dividends, not just through contracts or cheaper prices, but through more productive, more efficient business strategies and business outcomes. And, the old cliche, I think plays well. Timing is everything. And I think we heard a lot of timing examples. And, I wrote this down and underlined it on my notes today. Timing is everything. And you can have a great, and think about timing is everything. It reminds me of the example of the tablet computer. Remember right before the big announcement of the iPad, people were saying it can't be a tablet because the tablet was tried and it didn't work. Well, look where we are. And I think that it's an element of timing. I think it truly is an element of timing.
I don't think we talk about market entry or market entry timing enough. There's so many different pros and cons or advantages and disadvantages of being first to market, second to market, being a late entrant. And if we don't have a sense of that marketplace and know what kind of entry we're doing into the market, then we're not going to be leveraging those advantages or kind of being prepared for those disadvantages. And most of the time, I hear, when are you entering into the market? When my product's ready. Well, that's strategic. Well, it's always a joy to have you guys on the show. Thank you again for such a great conversation and for joining me. And I look forward to many more together.
Thank you very much.
All right. Thank you.
Thank you so much for listening. I know you're busy working to bring your life-changing innovation to market, and I value your time and attention. To get the latest episodes on your mobile device automatically, subscribe to the show on your favorite podcast app like Apple Podcasts, Spotify, and Stitcher. Thank you for listening, and I appreciate everyone who shared the show with friends and colleagues. See you on the next episode of Health Innovators.